According to the Quebec government's own data, surgeries performed at private for-profit clinics cost taxpayers 1.5 to 3 times more than in the public system.
And the result is quite clear. It can be, it is way more expensive.
From 2016 to 2020, Quebec ran a pilot project in 3 private for-profit Montreal clinics to figure out if they were more efficient. The findings were never publicly shared. But through a Freedom of Information request, researchers with an independent nonprofit found for all 5 procedures tested, costs were higher in private settings. In 2019, a short colonoscopy cost nearly $740. In the public system, it was under $300. Data also showed the public system was able to bring down the costs of most procedures over time, while costs in private clinics mostly increased.
Even on the efficiency side, we don't see an advantage at all to these private clinics.
In response, the Quebec Health Minister's office said the data is a few years old and the costs of the private sector do not include the same elements as the public. The for-profit clinics argued public institutions do not include building renovation and equipment depreciation costs.
I would take that with a grain of salt. I think we do know.
Health policy experts say hospital costs are generally fixed because the infrastructure already exists, while private clinics are duplicating services, taking staff from public hospitals, and charging more to make a profit.
I think it's really a concern.
Longhurst says Quebec and other provinces simply aren't making healthcare decisions based on evidence.
It does raise some profound questions about whether governments are serving and acting in the public interest or whether they are acting in the interest of corporations and investors.
And Christine, Quebec isn't the only province planning to use more private clinics.
Yes, we've seen other provinces, including Ontario, saying it wants to expand private for-profit care. Ontario's premier said he wants to follow the best ideas from across the country. It's just not clear what the best ideas are. We all know the healthcare system needs to change. Some surgeons are in favor of these clinics, but others will tell you there's little to no evidence that this model is the way to go. And if the goal is to reduce wait times for everyone, if you look at Canadian data, Quebec has some of the longest wait times for typical surgeries, including hip and knee replacements. We spent a lot of time digging into whether private for-profit care is cheaper, safer, and faster, and we've posted some of our findings on the National's Instagram page.
All right, Christine, thank you.
You're welcome.